A really terrific speaker tonight, I think just perfect for tonight's evening. Dr. Michael Lewis is the William Russell McCurdy Physician-in-Chief and Chief Pediatric Cardiology at Maria Ferrari Children's Hospital at Westchester Medical Center. He's also a professor and vice chairman of pediatrics at New York Medical College. He graduated from Yale and then attended medical school in Philadelphia at Drexel. He stayed on in Philadelphia for his internship and residency in pediatrics at CHOP. He spent a year in London at the Hospital for Sick Children and then returned to New Haven for his pediatric cardiology fellowship at Yale. He has edited textbooks. He's authored or co-authored over 120 scientific publications, including chapters in 22 major textbooks. He was co-author of the landmark 2007 American Heart Association Guideline Statement on Endocarditis Prophylaxis and was writing group chair of the recently published revision of the Drones criteria for the diagnosis of acute rheumatic fever and the 2015 AHA Statement on Pediatric Infected Endocarditis. Giving the very apropos talk, Researching the Research, Insights into Development of Cardiovascular Practice Guidelines, please welcome Dr. Michael Lewis.
Thanks, Jared, and I'd like to thank Jared and Dr. Flynn and other members of the group for inviting me tonight. It's especially poignant for me. I did know Dr. Steinfeld a little bit. He actually was one of the pioneering pediatric cardiologists in this area, as you know, and in 1982, I guess, we were doing, Dr. Rashkin was doing some innovative work in the early days of closure of atrial septal defects in the cath lab, and was looking everywhere for patients. And actually, Dr. Steinfeld volunteered one of his patients and came to Philadelphia with the patient to watch the procedure, and that's the first time I met him. And then when I moved to New York a couple of years later, at the Janet Baldwin dinner of this society, when somebody in your family was an officer of the organization then, he actually sat me next to Len, and he gave me a very precise and, as only he could, well-described introduction to New York pediatric cardiology, a who's who and a who shouldn't be who. And that really helped me see them. So I'm very honored to participate in this event tonight, and also the fact that it is a research symposium for trainees. Just this morning, in fact, we celebrated the 6th annual Paul Wolf Training Teach You Day in Valhalla, and many of you knew Paul and knew his contributions, and so it's a bookended day of a very important event, so I'm very happy to be here tonight. There's no primary to get home to watch tonight, so we'll be able to proceed. We're going to talk a little bit about guidelines and how they come about, and maybe how they shouldn't come about, and some of the caveats about guidelines as they influence our lives nowadays. I have no disclosures for this talk tonight. So the goals are to understand the functioning